What's tricky with chronic pain and persistent pain when it comes to movement is that there's this really fine window within which you can move in. Move too little and you risk continue having your muscles atrophy and just becoming weaker and weaker. Moving too much and too intensely, then you might risk bumping into pain and irritating your nervous system more. So what can you do? Hi everyone, I'm Elaine Young. I'm a certified yoga therapist and yoga teacher, merging yoga therapy and pain science so that I can bring you practices that help you rise above your symptoms and become more resilient. Be sure to subscribe to my channel, as every Sunday I come out with a new video to help you manage your pain and your symptoms. In today's video, I'm going to guide you into a short and simple movement awareness practice that will help you mobilize areas in your body that feel tense and tight and maybe with a little pain, but still within a safe boundary. This will be coupled with a breathing practice so that we continue to calm the nervous system as we continue to explore what feels safe to move within. When your body and brain registers evidence of safety in your environment and in the way that you're conducting movement in your body, it actually will help de-escalate any painful sensations. So for our movement awareness practice today, find a comfortable place in your house where you can lie down. This can be on the floor like shown here, or it can be on your couch or on your bed even. As you lie down, grab whatever props that you need to help you feel comfortable. It can be a pillow for your head, maybe a blanket for your body if you tend to cool down. So as you lie down, get yourself comfortable. You can have your knees bent and your feet on the floor, or you can have them stretched out, whichever is more comfortable for you. I'm going to keep my knees bent, my feet on the floor to support my lower back here, but you can do whatever feels most comfortable. Either rest your arms by your side with your palms facing upwards, or have your hands folded over your belly, elbows resting on the floor. Take a few easy breaths in and out. If you have your hands on your belly, perhaps you can feel the way that your breath comes into your belly and rising into your hand and softening down as you exhale. You can focus on the movement of your belly for a few rounds of breath here. And that in and of itself can be a very soothing anchor of focus whenever you feel stressed, when there's a flare or you feel depleted. Now you're going to bring your hands into fist. So if you had your hands on your belly, you can just make a fist. You can keep them on your belly, or if they were on the floor, you can just lift them up a little so that you can circle your wrist slowly. And continue to breathe with ease. Notice your breath. Does it start to tense in any way? Do you tend to hold your breath? And if you do, so you can smooth out your breath again. Go and reverse the circling in your wrists. Once again, notice what happens to your breath. Is there tension in your body? And if so, is it possible to release that tension? Allow your breath to smooth out to your best ability. And then rest your hands down onto the floor by your side. Still keep your fingers closed. And then just open and close your fingers a few times. Stretch your fingers out and then close your fingers back in. And just let your breath continue to go at an easy pace. You don't need to match your movement with your breath in any way. And as you continue this movement, once again, notice what happens to your breath. Once again, notice if there are tension in any areas of your body that is unnecessary at this point. Perhaps your face, your eyes, your jaw. At this point, they don't need to tense or make effort in any way. And the next time that your hands open, you're going to stretch them out and then let them relax here. Good. Bring your attention to your left arm and left hand. And then bring your fingertips, bending your elbow, bring your fingertips to your shoulders so that you touch. If you can't quite touch your shoulders, just bring your hands close to your shoulder. And then reach your arm up over your head to your best ability or towards the ceiling. And then bring your fingers back down to touch your shoulder or bring them towards your shoulder. And then come on back down to the floor. So you're going to repeat that a few times. Again, let your breath just be at its natural pace. You don't have to match the movement with your breath. So with this movement, if there's any point that just doesn't feel right, you don't feel safe to do, you don't have to do them. You can simply watch or imagine that you are doing these movements. As you continue to move your left arm or imagine that you're moving your left arm, notice what happens to your breath. Notice if there are any excess tension in your body. And if your breath starts to become shallow or you hold your breath, so you can smooth out your breath. And if you're holding unnecessary tension in areas of your body that is not needed right now, so you can soften that tension. The next time that your left arm comes back down to the floor, you can rest that arm. Pause here and scan through your body. Did that movement feel safe? Are you okay now? Can you soften the engagement that you use in your left arm? Now you have a choice to pause here or stop here completely and just imagine the movement if you didn't feel like the movement was safe. If the movement felt safe, your body still feels fairly calm and relaxed, and you can repeat the same thing with your right side. Continue breathing with ease as you bend your elbow, touching your fingers to your shoulder or bring your hand towards your shoulder. It doesn't have to necessarily touch. And extend your arm up to the ceiling or behind you towards the floor. And then bring your fingertips towards your shoulder again. Touch if you can. And then lower your right arm down to the floor. And again, touch your fingers towards your shoulder. Extend your arm. Breathing with ease. Again, the breath does not have to match your movement in any way. But what I would like you to pay attention to is, does your breath change through the course of these movements? Does your body tension change through the course of these movements? And if your breath changes in the way that it's becoming shallower, shorter, so you can smooth out the breath. And if your body tension changes in that, there's some areas in your body that start to grip, so you can let go a little bit through the tension. And continue to ask yourself, is it safe to continue? Can I keep my body and my breath calm? And if it doesn't feel safe, doesn't feel calm, you have the full permission to stop. And just continue watching, or you can imagine the movement. The next time that you bring your arm down, you can rest there. Pause and take an inventory. Did that movement feel safe? Am I okay now? Can I soften and ease body tension? Can I soften and ease my breath? And on your next exhale, bring your left knee in, hold with your left hand, and then bring your right knee in, hold with your right hand. then allow your body to slowly rock a little left and a little right, as if you're cradling yourself. And roll onto one side. Stay curled up on the side for a few breaths here. Taking a moment and observe your body tension, observe your breaths. You can calm both of them down here if there's any tension. And when you're ready, press yourself slowly up, or you can stay on the floor if you like, stay on your bed if you like. So let me know how that body and movement awareness practice went for you. If you have any questions, you can reach me at elaineyogatherapy@gmail.com. Again, be sure to subscribe so that you don't miss the Sunday videos that come out every week to help you manage your pain and become more resilient. Take care for now, and I'll see you next time.